GL11 Hub started 21 years ago. It started off with a very family start, but now it's for everyone really. So we do a whole range of activities for older people, for kids. Then of course the pandemic hit and we had to shut. And so everything we did was external then. So then we set up street volunteers to support every street in the area. And we had a phone hub, so everyone was phoning. We know that we've actually saved quite a lot of lives because of the mental health issues that people have had. I think we're just really lucky in this community that we've got GL11. We were directly supporting 10% of the community with prescriptions and shopping and mental health support. We had 5% of the community volunteering here. People were volunteering in the vaccination centre and with street volunteers and delivering food bank and just so much. It's been a real community effort. We've seen an amazing amount of community kindness. We've got a really significant mental health programme now because during the pandemic what we found was with so many of the calls people were phoning up because they were isolated and lonely and just needed someone to talk to. And then we found that people weren't just lonely, they were developing mental health and anxiety and depression issues during the pandemic. We then got the money from the lottery and started having some caseworkers to support people. And that then evolved into partnering with the primary care network to set up a counselling service. And so now all the GPs can refer people direct into the counselling service. There's 800 referrals a year. That works with 4 local GP practices.
I mean, there's a lot of different levels that community groups like GL11 can help. Some of it is directly supporting vulnerable people with difficult lives, really, and those sort of people tend to attend GP surgeries more than other groups of people. So quite often if you can get them engaged with GL11, either helping as volunteers or being sort of supported, they're less likely to come and see you as a GP. So that helps us. And it helps them because often their problems aren't predominantly medical in origin. They're usually psychosocial, which is difficulty with life. And GL11's much better positioned to help with that than GP surgeries. So it's a way of sort of repositioning care, if you like. We've got to encourage work between the sort of statutory sectors, and what I mean by that is sort of social work, medical healthcare, and the community and volunteer sectors, because if we don't do that we're just missing a real big trick in the health service, because we can make people a lot better if we use voluntary service. Now the way we do that, I think, is we try and reduce regulation, because even now, and we've set up a fantastic mental health counselling service with GL11, it's been so difficult because we've had to go through a number of different hurdles to satisfy various different bodies. If we can get rid of all that, we can start acting much quicker and much more effectively. Obviously we need to be safe, and we've built a very sort of rigorous governance system around it, but on the other hand we don't need to have all these rules around where the funding comes from and stuff. So yeah, if you can take down some of those rules, and I realise some of them are national and they are more difficult, but that should be the route of travel, I think, for all of us in Gloucestershire. Take down barriers and let's get on with helping the vulnerable people in our society.
We need to be able to work in an equal partnership and not try and distort ourselves to fit into that bureaucratic way of doing things. If all the communities could join together, my goodness, what a difference it could make to the strategies in terms of just effective delivery. It's so much more cost effective. We haven't got layers and layers of management. We haven't got layers and layers of rules to follow and committees to go through. We can just hit the ground running. Within a week of shutdown, we were up and running, delivering in the community, answering, I think it was 3,000 or 4,000 phone calls in last April. We're agile, we're fast, we're responsive. In partnership, we could do so much.